Now, the World Health Organization says Africa is not yet ready for what is gearing up to be the largest ever immunization drive on the continent, around the world as well. According to the WHO, Africa has an average score of 33% readiness for a COVID-19 rollout. This is below the desired 80% benchmark in terms of readiness. Now, in order to achieve overall immunity across the continent against COVID-19, at least 60% of the population should be immunized. This equates to around 1.5 billion doses that will need to be funded. Let's unpack the story now. We're joined by Dr. Phionah Atuhebwe. She is the Regional New Vaccines Introduction Officer at the World Health Organization's Africa office, that's in Brazzaville in Congo. Dr. Atuhebwe, thank you so much for your time this morning on the AM report here in South Africa, in Johannesburg. Let me begin by asking you this. I mean, it's been such an exciting time over the past couple of weeks around the world, as we've seen a number of vaccines come out with 90, 94, some 95% efficacy against the coronavirus. One vaccine says it's 100% effective at preventing serious cases of COVID-19. But how optimistic can we be as Africa?
Thank you very much. Yes, as Africa, we are very optimistic because, one, the presence of the vaccine itself, is a highly efficacious vaccine, not just one, but a number of vaccines, is something we are looking forward to, and we do have the vaccines now. There are many other issues that need to be tackled, but at least we have the first step, that we have the vaccine, and efficacious vaccines have been found. So even as WHO and as Africa, we are quite optimistic because much as our epidemiological profile has been different from the rest of the continents, we've still suffered the consequences of COVID-19. So we are really optimistic with the vaccine.
I mean, there's one vaccine that we're told in the US that will be rolled out as early as the 21st of December. That vaccine is now in emergency use authorization stages. And when we talk about seeing the vaccine on our shores, in our countries, in Africa, a lot of coverage saying we're looking at mid-2021.
We are looking at actually the first or second quarters of 2021. So mid is really the long farthest that we think we shall introduce this vaccine. But we really are hopeful that by the end of the first quarter, if things continue at the tangent that we are seeing them, with a number of candidate vaccines showing a high efficacy, with vaccines with ambient temperatures that we could utilize, especially in Africa, with vaccines that are in the portfolio of the COVAX facility, the more we are expecting a number of them to be done with the phase 3 trials and immediately commence the emergency use listing authorizations. We hope that by mid-2021, we shall have had some rollouts in Africa.
Yeah, I mean, you know, as optimistic as we are, I'm sure mid-2021 seems like a lifetime away for us here in Africa. You know, if we're looking at the 21st of December, a few million vaccines to be distributed across the US, is it a case of, aside from the issues that relate to the vaccines themselves, just in terms of, you know, whether they need to be stored at certain temperatures, whether other vaccines are better capable of being transported around the world without that need to be stored at particular temperatures, or is also a fact of money? Is money also an issue when it comes to getting the vaccines to the continent sooner than, as you say, the latest mid-2021?
First of all, I should say that we are looking at really getting these vaccines on the continent before mid-2021, the earliest, as soon as possible. Is money an issue? No. For now, money is not an issue, not even for Africa. We always have issues with money, but money is not an issue because we run this COVAX facility that is co-led by WHO, Gavi, the Vaccine Alliance, and CEPI. And these three have come to with an other number of partners. And this has shown the highest global solidarity collaboration that we've ever seen in the world. Rich countries, poorer countries, high income, low income countries have all come together to pool the amount of funding that we need to give us the first set of vaccines for the first set of vaccines that we'll get, we've prepared at least 20%. We are getting prepared for 20% of each country's population globally to benefit from these vaccines, whether high or low income. And this will happen at the same time. So whether we need the ultra cold chain like the Pfizer vaccine needs or anything, we shall roll out the vaccine, and at the same time in high and income countries. The emergency use listing, yes, is going on for the Pfizer vaccine and the Moderna vaccine, but the same process has started for AstraZeneca and the Russian vaccine, so which are being kept at the 2+2 to +8, which are ambient temperatures, and these are still vaccines that are within the portfolio of the COVAX facility. So really, we are working as much as we can to ensure that we get these vaccines to the continent as early as possible.
Dr. Atuhebwe, so we need 1.5 billion doses of the vaccines on the continent to achieve that threshold of immunity. You talked about 20% of each country's population in Africa getting the vaccine. What about the issues around the readiness of countries on the continent to safely roll out the vaccine? Many countries scoring well below the threshold of readiness, the target of threshold being 80%. Many countries scoring as low as 33% in terms of readiness. What does that mean? It means that countries will be struggling themselves to safely roll out these vaccines?
So what does the 33% mean? 33% is a weighted readiness for the region. So meaning a certain country could be at 60, another country could be at 10%, or another country, but we do measure various parameters. We do measure the planning and coordination. We do measure, have countries decided on their target population, because the prioritization of who gets the vaccine is being done at country level. Mm-hmm. Do the countries have enough cold chain capacity? We are still in the assessment of, at the tail end of assessment of the cold chain capacity. Once that has been done, we shall move by another probably 5 points. Demand generation, the communities, the communication, the training. What has pulled us back a lot is the training of health workers and vaccinators on the immunization. But this training cannot happen before, we still have many unknowns, but we are still preparing the tools and packages which we shall roll out to countries. And as soon as these tools and packages are out, the monitoring and evaluation, the moment the countries give us who their target population is, and we've given a deadline of December 7th. And once we have all this from our African countries, we shall move. Really, the difference in preparation shall be really evident. Yeah. But without enough information on the vaccines that we shall get on the continent, we still see a lot of unpreparedness. But we are really optimistic. And the World Health Organization really, and partners, are putting their foot on the ground and are everywhere with footprints in all these countries, supporting them to prepare for this introduction.
Yeah. I mean, in the meantime, we're still having to get through the stage now of the December festive season. Many countries, here in South Africa, certainly many of our provinces are already gearing up for a second wave of infections. I mean, the hope is that we don't go into 2021 with a second, possibly even third wave before we get the vaccine here on the continent?
Well, that would be a tall order to say that we get into 2021 before we get the vaccine. The vaccine is just one of the tools. So it's an additional tool, and our main goal with the vaccine is to stop the acute phase of the pandemic, to stop the morbidity and mortality that we are seeing associated with this pandemic. That is the primary goal for now, because the vaccines will not be enough. You mentioned that the continent needs 1.5 million vaccines. We cannot get that number because we shall not have that number. Even with all the vaccine candidates that we have, that we're optimistic about, the doses will not be enough. So what we are looking at as the COVAX facility is to deliver at least 2 billion vaccines by the end of 2021. And this is globally. So really, communities must not be complacent with the SOPs. They must stay masked. They must remain out of crowds, social distancing, and all the sanitizing and washing of hands, because the vaccine is just an extra tool. The vaccine itself will not end this pandemic.
Dr. Atuhebwe, thank you so much for your time this morning on the AM Report here in South Africa. Dr. Phionah Atuhebwe is the WHO's new vaccines introduction officer. Yeah, I mean, some sobering information there. The vaccine is not going to be the balm that we need to solve this crisis. We need to continue with those non-pharmaceutical interventions. Some shocking numbers there. 2 billion doses of the vaccine expected by the end of the year, and that is apparently around the world. Incredible stuff there.